has changed in the bill that would get conservative members who may have been opposed to it 24 hours ago to change their vote to a yes today?
Well, there's some details with the Medicaid. Our goal is to get Medicaid back to the states. With Obamacare, there was a huge Medicaid expansion. Large majority of the Medicaid expansion were actually able-bodied adults. Our goal is to responsibly unwind that Medicaid, get the flexibility, get the money at the state so that they can set up the best programs possible. The conservatives had some concerns about how the details of that process, and those are some of the types of details that we're addressing.
Very interesting. So Medicaid is one of them. Give me another one. That's a concern.
Well, another one is the tax credits. We in this proposed bill, we're offering tax credits for individuals that do not get their health insurance through their employer, do not get their health insurance through the government, whether it's Medicare, Medicaid. We want to ensure that we have a vibrant market for individuals. And part of that is a tax credit, allowing individuals to keep more of their hard-earned dollars and then be able to go spend that money in the way that will best meet their health insurance needs, both for them and their families.
Okay, now
the amount of that tax credit, how it's phased in, we have it adjusted for age. Some of those details are some of the very details that the members are, first of all, better understanding, asking questions, and then at times making adjustments so that we continue to get the votes that we need next week on the floor.
Yeah, also, the president just said it's going to take some time before it gets better. Is that a year? Is that 2 years? Is it more than that?
Well, I think you'll see immediate relief. You will immediately see that there's going to be more choices in the marketplace, that the premium increases are not going to be what we're anticipated. But I think what he's referring to, that is, as these reforms continue to be implemented, that you're going to continue, you'll see a more vibrant health insurance marketplace. You will see more plans, more innovative solutions. I'm really excited.
Okay. You're going to have to explain to the American people, the drawdown process, because if you go forward with this, you know that people will be, if they've been harmed by Obamacare financially, that they're going to expect immediate help, and that may not happen. Can you sell that?
Yes, for anyone who is on Medicaid expansion, for example, we commit to ensuring that they will not have the rug pulled out from underneath them. We make a commitment to them. But for example, health insurance companies later on this spring are required to post their proposed premiums, their rates for 2018. So any relief that we can give them, the sooner the better, in giving them an ability to offer more choices, more plans in the marketplace, that's going to benefit 2018. As we continue to move forward with more of these reforms, you're going to see more plans made available. And over a 10-year period, CBO is projecting right now that premiums would come down 10% across the country. And we believe that as we continue the reforms at Health and Human Services, phase 3 of this bill, or this plan, that would include the cross state lines, the association health plans, opening up even more options in the marketplace, that we will see even more dramatic reductions in premiums. So that's why the president says that it's going to continue to get better.
And here is what he said a moment ago, then 2 specific questions after this. Watch here from a minute ago at the White House.
All of these no's, or potential no's, are all yeses. Every single person sitting in this room is now a yes. And we made certain changes. I also want people to know that Obamacare is dead. It's a dead health care plan. It's not even a health care plan, frankly.
I have a minute left. You mentioned phase 3. Tom Cotton, a Republican senator from Arkansas, calls that a myth. What do you say to him?
I say that he needs to get on board with the plan. There's items that we can address immediately, and we must, because Obamacare is on a path to destruction, higher premiums, less choices. So we must take action immediately. There's other items that it's going to require 60 votes in the Senate, and we got to go to work on that.
All right, last question. Will you bring this to the floor of the House next week, as was stated earlier today by Tom Price and others?
Yes, yes, we are on track. We're very encouraged. We're going to continue to be working every day, bringing it to the Rules Committee early on next week and onto the floor for passage.
Wow.